respiratory professionals and patients join together with one goal in mind: advancing the quality of care for patients. The theme resonated with all attendees at the AARC Respiratory Patient Advocacy Summit at this year's AARC Congress.
Primarily, it's very important to hear the voice of the patient. I mean, that's what I'm here. I work in patient advocacy, really trying to understand their journey, their gaps in care, ways to bring all the stakeholders that, focus on lung health together. I think the respiratory care, respiratory therapists, the caregivers, the physicians, the nurses. I mean, everyone has to come together to focus on what's best for the patient, including the researchers and those that deliver the medications to the patients.
This event brings them together to speak to specialists on their expertise and network with each other. And they can basically have time with their respiratory therapist, sitting at a table, just enjoying themselves and being able to talk to them without being in a clinical setting.
Spokesperson Grace Ann DORNEY KOPPEL opened the meeting with a lecture on the COPD patient. Diagnosed with chronic obstructive pulmonary disease in 2001, she's dedicated her life to creating a better future for those affected by the disease. KOPPEL, the president and founder of the DORNEY KOPPEL Foundation, hopes to bring COPD out of the shadows and into the spotlight.
Your simple cold or flu can become and release a chain of events in me that can trigger severe respiratory symptoms.
Cystic fibrosis is another chronic illness that impacts the lives of about 30,000 patients in the U.S. today, while still hiding under the radar. Claire WINELAND is no stranger to that. Claire is only 20 years old and has already had 30 surgeries, spending a third of her life in hospitals.
How do we help other people realize that there's not a difference between someone who's sick and someone who's healthy?
Claire knows she's not alone and wants to shed light on what it's like to really be sick, like the thousands of others affected by cystic fibrosis. As always, the mission of the Respiratory Patient Advocacy Summit is to build partnerships between chronic respiratory patients, caregivers, advocates, and respiratory therapists to work toward better respiratory care. Lectures and discussions covered topics like patient rehab, living with cystic fibrosis, and patient advocacy.
We spend a lot of hours with these patients. We tend to maybe even spend an hour for just one part of the therapy. But I don't think they always want to hear about the education part of it. So I'd love to know a little bit more about what the patient would like us to talk about.
I know my body better than you do. So if I tell you that something's wrong or I think that you need to modify something, you need to listen to me. But yeah, I think they need to feel like they're appreciated, and I know I wouldn't be here without pulmonary therapy.
With so much struggle comes an even greater symbol of strength. The summit continued with the National Patient Advocacy Award, a collaborative effort between the FACES Foundation and the AARC. This award identifies and honors registered respiratory therapists from across the country who demonstrate excellence in compassionate care for patients and families. This year's National Patient Advocacy Award goes to Chris HARTLING of the Primary Children's Hospital.
Every single respiratory therapist is an advocate. They're an advocate for their profession, they're an advocate for their patients, they're an advocate for themselves. And it's action. That's all that advocacy is action.
For more information on legislation, resources, and patient advocacy, visit aarc.org.